and then we would close them out. So this year, Ash and I are being proactive, and we're looking at the line items in advance to see how much do we actually think we're going to spend, and if we know that we're going to have some excess, we are moving that to the unobligated, just so that we can have a clearer picture of our financial position. So right now we're at 83,000, and I can assure you that we will spend every dollar of that money. Um, we are still looking at that Odyssey, and there's the report online for our visitors. So we are still looking at that Odyssey Technology Fund that will provide funding for us to revamp the website. So that we're still on track for that. It's been approved by MMB and a couple of other people. And so right now it's just waiting on legislative approval, but it looks good. So I think that for sure that should happen. Can't say with absolute certainty, but it's looking very promising. And the other thing is, what you don't see that's not here is some of the Juneteenth funding. So some of the Juneteenth items have not been allocated. We're finishing up with that. And then there are some other things that we said we're going to do. We still have to buy some supplies and things like that. So we are in great position. And Ash has been doing a fantastic job of making sure that we understand fully what the dollars mean, so that at the end of the fiscal year, we will have spent our allocated money appropriately. Oh, and since I'm on the financial report, I'm going to report right quickly that we also did receive an increase to our budget. So I had put in for funding for 2 additional positions, so that one could focus on the African market in relation to policy, and then one in relation to community engagement. So that came through, as well as an increase to the budget for just general increase due to and Councilmember Adams Lee, welcome. She joined us. So just an increase, just because the cost of goods are increasing, as we know. So I am extremely excited behind that, and that will make a significant difference in terms of our ability to serve both communities. So that is it for the financial report. Any questions? And it sounds like at the end of this fiscal year, then we should be pretty much down to zero. Yes.
Madam Chair, I do have one question. With the increase in our budget, was that for all councils, and did all councils receive the same amount?
No, they did not. In the fall, I put in a request for a change item. So each agency has the opportunity to do that. And each agency, all of the ethnic councils submitted their own request. And so the budgets are different based on what they requested. So each council got what they requested, but I requested a little bit more. And so I got what I asked for, and I'm very excited about that. So yeah, very excited. So not hearing any questions, let's jump back to approval and actually roll call now that we have a forum. So if I can have city staff with roll call. Chair Hughes. Vice Chair Doe. Treasurer Mullins. Secretary Adams Lee. Council Member Daniels Jawasime. Councilmember Crawford, Councilmember Nadi, Councilmember Mayor Winston, Councilmember Dukes, Councilmember Dahir, he was excused, Senator Fateh, Representative Frazier, and then Representative Hudson. And yep, I have that down. Okay, and then Hudson did send in, I guess, a couple days ago that he would not be able to attend as well. Thank you. Any discussion? All in favor, say aye.
Aye.
Any opposed, same sign. Any abstentions, same sign. All right, motion carries. All right, so we are ready for our speaker. So we have Helen DeBree, who is from Department of Human Services. We're gonna go ahead and hear what she is. And repeat your name, Helen. Okay. And this will just take 1 minute. We are navigating between Facebook Live and people presenting, remotely. So yeah, so we're excited to be able to have that capability.
Okay. Well, you were pretty close. Is this on? All right, you can hear me. All right. Well, I'm excited to be here with you all. My name is Helen Gebre, and I am with the Department of Human Services, and I serve as the Director of Community Relations. And in short, our role within the agency, which as you know is pretty large and complex, is to help support for program areas and the agency as a whole to do really meaningful community engagement. And so we've been tasked in helping support this initiative that I'm going to be talking about related to Medicaid renewals. I should also note that I have a colleague here from DHS who's online, Jeremy Wilson. I think he is online. I just can't see. Yep. And he'll be on hand to help answer some policy related questions. So, all right. And I'm getting some help here. Well, that's okay. So maybe as we're getting the PowerPoint set up here, and I should note, we did send the PowerPoint ahead of time. And so if you haven't, please feel free to share with members and any other interested folks. So again, our focus today is to really talk about how we're going to help Minnesotans who are on medical assistance and Minnesota Care keep their health insurance. And so an important part of that work is really partnership and reaching out to groups such as yours who are visible and trusted within the community that we need to reach. And so an important part of our role is to provide you with all the information that you need, make you aware where you can access resources in order that you are going to be, I think, an important and trusted messenger in getting the word out. And so with that, I wanted, oh, we are, okay. You're able to see the PowerPoint, correct? All right, so it's, after hours, so it's a bit relaxed. So again, helping medical assistants and Minnesota Care enrollees keep their health insurance. That's really what we're here to talk about. And again, I think what I'm hoping to leave with today is that this is not going to be the first and last conversation and engagement that we have around this need, and that I will leave with you my contact information because, as I said, the focus of the area within DHS that I support is really to be able to reach communities, provide them with access to the right information at the right time, but more importantly, with the resources for them to take the action. So we do need to do more than just getting the information out, but also linking with the right resources to assist when it's time for them to renew. So with that, I will try this. All right. It's working for me. So focusing on maintenance of coverage and public health care programs, I'll just do a little bit of recap of sort of how we got here, right? And so as you know, like all states, Minnesota maintained healthcare coverage for its Medicaid enrollees during the COVID pandemic. So since March of 2020, Minnesotans who newly were gained eligibility or were already eligible for Medicaid, which is also known as Minnesota Medical Assistance in Minnesota or Minnesota Care, have been able to stay enrolled regardless of any changes in their lives that previously would have affected their coverage. So in this period of the pandemic, due to the public health emergency status, this warranted that families, individuals were able to maintain coverage over the span of the pandemic. So the continuous coverage helped Minnesotans access care during the global pandemic. It helped the state maintain high insurance coverage rates. It also allowed the state to receive billions of additional federal funding under the Family First Coronavirus Response Act. So the Coronavirus Response Act was the first major federal stimulus package passed by Congress. It stipulated that continuous coverage provisional ended with, sorry, it stipulated that the continuous coverage provisions would end with the end of the pandemic. And so now, with these continuous coverage in place, at that time, enrollment in medical assistance and Minnesota Care, really, we saw an exponential growth in individuals, families who were able to be eligible for public health insurance. And this was a growth of more than 360,000 or more than 30%, which now we are facing potentially 1.5 million people that were eligible and were enrolled in public health insurance, that this would warrant us to look at potentially the re-enrollment of that significant amount of individuals and families. So this also translates into that we have 1 in 4 residents living in the state of Minnesota that now get their health insurance through Medicaid, so Minnesota Care or medical assistance. So quite significant. So with this sort of framing, you can imagine how vast of an undertaking that we have in front of us, right? So just some quick hits here then. As was shared during the pandemic, the annual eligibility renewal did cease. And then this condition enhanced federal funding through this Coronavirus Response Act. as I said, I'm multitasking here, so moving to the next slide. There we go. All right. So then we sort of fast forward to end of 2022, and Congress passed the Consolidated Appropriations Act, which meant that comes to the end of the continuous coverage, and that was to go into effect, and which went into effect March 31 of 2023. And this then warranted that states were required to return to standard eligibility procedure for Medicaid. So that means medical assistance, again, Minnesota's Medicaid program, and Minnesota Care enrollees must have their eligibility now reviewed once a year to ensure coverage. And this is the process that we call renewal, which we're in the midst of. So then again, looking at more than 1.5 million Minnesotans who are on these public health insurance will need to go through this eligibility review process. And this is to run through March of 2024. So DHS, along with many other partners, counties, and tribal entities, is really committed to ensuring that eligible Minnesotans keep their public health coverage. And ensure that the renewal process resumes as required through by the federal legislation that directs states to return to standard Medicaid eligibility procedures. And I would say the state is really trying very hard to ensure that we have zero eligible enrollees that lose their coverage. But we can't do it alone. It requires all of us to be able to work together in cohesion with this shared commitment to ensuring that no one loses health coverage. Again, for additional context that I could offer, sort of, I think here's a focus again in a different way, the growth within the Medicaid program. In front of you, you see the percentage of families and adults without children, which is the green part of the pie. And then we have Minnesotans for people, medical assistance for people who are age 65 or older, who are blind or who have disability, represented by the dark blue. And then that 1.5 million, Minnesota Care is covered by the lighter blue, which is 104,700. So this really is approximately 25% of the population, quite significant and quite a broad reach across the state. The other sort of factor that I want to orient us to secondarily is, well, who accesses public health insurance? And I'm sure this is not new to you all, but we do see that the data shows that percentage of Minnesotans that get their health insurance through Minnesota Medicaid, reflected here by race and ethnicity and geographic location. So we see that a large number of Black, Indigenous, and communities of color get their coverage through Medicaid. Similarly, on the what is on my left hand, we see the geographic representation where we have a large number of Minnesotans in greater Minnesota also get their coverage through Medicaid. So we know then any changes to this program is going to have a significant and disproportionate impact on these groups. So even more so for us to really hone in why this is important, how do we get out in front of communities along with trusted community partners, trusted messengers to deliver the message. And that's really what our effort is here and the role that my team has in support of this work.
Before you go to the next slide, so I just have a quick question. So under other, is that classifying two or more races, or is it just other as it doesn't identify within those areas? And I'm presuming it's two or more races.
I'm thinking that as well, but it could also be encompassing of broader than that, but definitely And so I think real quick, just around the race and ethnicity representation, we have 42% of Black Minnesotans accessing their healthcare coverage through this, through Medicaid. And then for American Indians and Alaska Natives, I believe that's 39%. And so I'm moving here on this end. And so again, it's the same populations that are disproportionately impacted across all systems, also overrepresented within this public health insurance. So, I think, again, we can't stress enough, any interruption to healthcare coverage is going to be a tremendously negative impact on individuals and families and children. Which is the next slide that I think for us to sort of focus on is the fact that a good chunk of children, 32% to be exact, of children in Minnesota get their coverage through Medicaid. So here you see a representation again of overall Minnesota child healthcare coverage, which is a bit smaller, I think, in representation, but that 61%, the dark blue, represents children who get coverage through public health insurance. And again, now across race and ethnic categories, you see also the disproportional overrepresentation. So then what is the state doing? How are we getting ahead of this and trying to stay abreast? There's been many efforts put into this. There are many ways that we're going to ensure that people do not lose their coverage and have the opportunity to enroll and know when they need to enroll. So there's, I would say, what we're calling user-friendly ways to complete the renewal process. So for the first time, Minnesotans on Medicaid will be able to upload the re-enrollment documents. In the past, and it still is the case, it is a paper process, but this option to be able to upload the completed document is part of the sort of innovations that's been created and developed in order to, again, minimize loss of coverage. The other piece to kind of point out here is that there information on the forms outlines how navigators can help. And I just want to spend a little bit of time of identifying how crucial and critical healthcare navigators are going to be in this process. So in the ways that you are working within your respective organizations and the networks that you have, I think an important consideration is to make connections with the navigator organizations that are within the vicinity of where you are or the people that you serve or work with. And that's, again, another opportunity that we welcome to partner with you on in identification of that. There is also the opportunity to check for enrollees. So one, to update your contact information. That's an important part of it. So in the span of 3 years, I think we can assume that people may have moved, have new contact information. And so it's important to be able to update. So then when it's time to renew, that information, that packet of information is going to the right place. Let's see, the other sort of, I think, ways that we have tried to make it easier is that enrollees can renew coverage automatically. And so for some, so this allows them to skip the paperwork and renew their coverage based on, again, the information being accurate. So that they're the trusted data sources that show that they continue to qualify. So this would be for eligible enrollees who, according to supplemental security income or SNAP or TANF eligibility, they would be able to automatically be re-enrolled. Um, let's see, what are some points here that I wanted? I think, at least I think I want to share that there's been a lot of thought put into how do we minimize the barriers. One of the ways that I see also an opportunity to partner with entities, groups such as yours is to think about, well, what are you hearing? What else could we be doing? Not assuming that we've been able to address all the barriers, but what else? And more importantly, where is the confusion that you are hearing from community at large? Yes.
So I'm wondering, in relation to the question that you're asking about area, I'm wondering about two areas. How much has been allocated out of the essential budget prior to the excess that the governor had identified? So how much of that, the biannual or the annual budget has been allocated to help to circumvent the loss?
Mhm.
And number two, if how much of the excess or the overages will be allocated to helping to circumvent the shortages? And then finally, my question is that I'm hearing from those in my community is how do we, if we didn't qualify prior to COVID, how would we know that we would be eligible irrespective of what's being told to us, these promises that they feel like they're getting? But many have concerns about the annual recertification is quite rigorous and could often, $10 to make them ineligible. So those are some of the questions around folks being told that they're not going to lose the eligibility, and how do they sort of work through that? And you may be ready to cover that, but that's one of my questions.
Sure. And maybe to the latter part of your question, I'll maybe ask Jeremy around eligibility policy, to address that if he can. But relative to funding allocation to support this, which I think briefly I wanted to talk about with the recent legislation that the governor signed the bill to help eligible Minnesotans retain, again, access to medical assistance and Minnesota Care. And so as part of that legislation, it allowed for funding to support partners who do this. So for navigator organizations, they would be getting funding to help enrollees complete the renewal paperwork, which again, I want to stress, we want to be able to connect enrollees with this resource. And as you know, as trusted community organizations, the navigators play an integral role in this process. You also may know that counties and tribes did receive funding to help with renewal. Up to 36 million was appropriated. In addition to that, if I'm hearing your question, what else or what more can be dedicated? I would say as part of the outreach, one of the things we've noted is that we do need to get funding for culturally specific media campaign, for example, in making sure that we're delivering the message in the way that the community needs to hear, that's going to resonate, but also in multiple languages. With that, I just want to ask Jeremy to kind of address the second part of your question, but I also want to check, was I kind of getting towards what you were asking, but I think maybe you were asking a little bit more. What else is being done is what
I wanted to know how much has been, you noted 36 million. So
Mhm.
is that part of your original allocation of dollars towards Minnesotans prior to us having this epiphany that we need to not let people lose their coverage? And then how much more, in addition to that, would we would be allocated? And I'm wondering, since you talked about the essentialness of the navigators,
Mhm.
how much of those dollars are going to be allocated towards, hiring navigators as opposed to going to Minnesotans who are at risk for losing? So those are always questions that are important for communities, because we say one amount, but what we don't always have the information around is how much of those dollars are actually going directly to the community and how many are going to be allocated towards for budgets.
Yes. I don't know that I have the answer to that, but I would like to take that in for consideration. And what I'm hearing, I think from what I'm hearing from you is, okay, there has been this appropriation of 36 million that has gone to counties and tribes. But in addition to either navigator organizations or other community organizations, how much and what, I think I'm also hearing how much more could be made available, including to hire new navigators, including to maybe do some other innovative ways to again engage and outreach to communities. And I don't have the exact number or sort of what is being considered, but I'd be happy to take that question and for our healthcare administration to continue exploring that. And again, I wanted to reiterate that that's clearly where we see the need for investment, especially from the outreach realm, where we can maybe continue investing in counties and and more importantly, maybe more tribes or a broader set of other community-based organizations that I think are well positioned, as I said, to do the work that we know we can't do. Jeremy is okay, perfect.
Before Jeremy speaks, I have a question, a concern that maybe he can add to it, because it has to do with eligibility. And the concern is because of the fact that the winding period now has started, continuing coverage has ended, and the concern about enrollees that be losing the coverage. What particular measures, that are being put in place for people to understand? Because here's the problem, right? If you're on medical assistant or Minnesota Care, and during the COVID period, you reported, say your income went up, but yet you still remain on Minnesota Care, and now all of a sudden, going back to the eligibility, you will lose coverage, because once that income change is processed, now you're eligible to go into the private market. So most people, I mean, to get a grasp of what's going to happen to them, maybe you want to speak to, what are some of the measures, whether it's just going to happen abruptly, or there's a period where you're giving maybe a couple of months before, because if your income is too high and your circumstances change, say by the 15th or the 20th of the month, and now you're supposed to get a private coverage, you just might have a lap in coverage that could actually impact a lot of people. So
Yes. I'll have Jeremy respond, and then I want to talk about how do we, individuals do no longer qualify, what else are we doing to mitigate factors of where people are dropped versus connecting to other potential. Okay, what do we need to do?
So you see how that recording is, yeah, that just needs to be clicked on. You can't see his face.
Do you know? Sure. Yeah, yeah.
So are we done with the presentation?
Well, we have a few more, but can we come back to it? Okay. There he is.
All right. Oh, can everybody hear me? All right, thank you. And thank you for having me this evening. Yeah, as far as the allocation, I really can't speak to that. But with respect to policy itself, and if I understood or could hear the question, it was kind of the initial question was like, what's being done, I guess, to kind of circumvent existing eligibility policies to ensure individuals kind of retain coverage during the unwinding period or post continuous coverage period. And then secondly, how are we, and I think, sorry, the second question kind of went to that and spoke of, how can we ensure that there's not a gap in coverage, that, potential income or asset changes don't impact eligibility. And I think one thing that's really good to clarify at the outset is that when we're looking at the, I guess, post-continuous coverage requirements, everything's going to be looked at through the lens of two coverage groups, and one is going to be the MA protected coverage group. So these are going to be people that had coverage, either medical assistance or Minnesota Care as of March 31st, 2023, and those who obtained coverage subsequent to that. So those who are in that first group that had coverage during or prior to April 1st, 2023, they're not going to have to, they're going to, basically the continuous coverage requirements will continue to apply to them until their very first renewal. So we won't be closing coverage immediately. We won't be acting on any changes, income changes, until their actual renewal. And at renewal, we've put into place with the Centers for Medicare and Medicaid Services approval, a number of additional kind of waivers that kind of ease that process, that renewal process. And so for those, for example, subject to an asset test, we are going to eliminate the asset test for their first renewal. So that means they'll be able to maintain coverage for another year without consideration of assets. Another thing is that's new, at least for the age blind and disabled population, is that we're going to be completing ex parte renewals, and Helen spoke a bit about this. And finally, I mean, we just really want to make it clear and get the word out there that there is a web page that has a number of resources that can assist everyone and ensure that they have access to all the information needed to complete the renewal. And so, whether this is expanding how we can process applications, which now, as Helen said, we can upload it to the website. We can even take eligibility information over the phone. There's a number of resources available that we have added that we hope will ease the renewal process for these individuals in the MA protected coverage group. And so, sorry, and feel free to ask more specific questions. I think there's still a number of topics and that I guess would help answer that question that are still to be presented during this and in subsequent slides.
Thanks, Jeremy. Was there any follow-up questions? I think one, I wanted to check how much time we had. One of the things I wanted to just review with the group is just the resources that Jeremy was mentioning and where to find those. And again, for me, from a outreach, community outreach sort of lens, is what else do we need? What else should we be thinking about? Assuming that we have this, but what more? And so I'd love to have a bit of a conversation around that as well, or come back again. I think you have a question.
Ask one more question about the eligibility. I'm trying to understand 32% of the children. And
Excuse me for 1 second. Can you use the microphone? Yeah, because if you don't, then the people online can't hear.
testing 1, 2.
Thank you.
Mic check. No.
Microphone checker.
I'm sorry. Thank you, Helen. Just wanted to know a little bit more about that 32% of children that are receiving coverage, and if the eligibility is the same as adults. And if that is the case, are there children that are going without coverage because they do not qualify? Or are all children in the state of Minnesota guaranteed insurance? Can you answer that question?
Good question. I'm gonna ask Jeremy to respond to that, if he's able.
Yeah, so the question was whether or not all children are eligible for healthcare in Minnesota. So, yep, so, yes, so, we do that. So I should clarify first that I work specifically with the age blind and disabled population. So, I will do my best to answer this question. But, yes, medical assistance, is available for children, although they will still, eligibility will still be, reviewed for the family in the household. And, so, there's a number of eligibility requirements that will have to be reviewed, household information, income information, to be able to make that determination, and to determine whether or not specific income deems to that child. But if, so long as eligibility requirements are met, and then the child would be eligible for medical assistance.
Okay.
Thank you, Madam Chair. I have one question, and that is concerning the misinformation and outreach. Are you planning, and how can the council help in connecting with community to give them the right information and opportunity to navigate this very difficult process? I know myself, it's very hard to figure out which is the right box for you to check. And in most cases, we throw our hands up and we walk away. And that's not the answer. So how can we help in assisting this potential tidal wave of folks that may be falling out of the system?
That's a great question. And I think that's the conversation that I want to have to guide us, tell us where is the opportunity for us to be with you, giving the information. What is confusing? What do we need to clarify? What else should we be communicating? And then I think to the point of how do we connect the healthcare navigators or those organizations in the spaces where you are with the community groups that you're helping or being having these conversations with. So to the point of, I think where we can't just deliver the message and expect people also to be able to execute. So that's, I think, the resource connection that's going to be important. But we need to sort of be in that dialogue and figure that out together. Oh, I'm sorry. It seems like maybe there's more of a interest of a conversation. As I said, we have the PowerPoint that we've shared with you. The resources, again, that I wanted to highlight, you'll be able to access there. One of the things that I want to send out post-meeting is a one-pager, again, that lists everything, but also has the contact for community relations. As I said, we're helping support the community outreach arm of this effort. And that's where I'm hoping that we can continue the dialogue. The other piece that I wanted to point out, if you weren't aware, is that there have been a set of roundtables that have been formed during the pandemic. And the one in particular that I guess I'm inviting you all to join and share some of these thoughts is the one for provider and community organizations. Because if we're not there in that space talking about these challenges, then we're losing the opportunity. And so I would like to invite you to consider to being in that space as well.
So real quick before Yolanda has a question, are there any community members online besides Jeremy? Joe, did you have any comments that you wanted to address? And the reason I'm asking that is because we do have a segment for public comments, but we can go about 10 more minutes with this dialogue. If you all are okay with that, making that adjustment, since Joe is our only community member, he can join in this discussion. And then that way, Helen, that gives you about 10 more minutes then And then I think if you want, you could probably move to the discussion piece, because I see that you do have a set of discussion questions, and we can move to that. But Yolanda, I know you had a question, and then Joe, if you have a question, and then we'll kind of move to discussion if everybody's okay with that.
I kind of fell asleep after a while.
Okay.
So, and then Linda asked me if I had a question. Excuse me. Are these the commercials that are currently being run, I think, on public access about the changes that are coming coming up? Is what I'm trying to say.
Are these the commercials?
Yes.
Um,
But the reason I'm asking, I'm one of those that's using Minnesota Care,
yes.
and I moved from Ramsey County to Hennepin County, but I understand this is a state-run program, but Hennepin County may be taking over my case. So I need to update my specific information to reflect that I'm now living in Hennepin County. And I do remember seeing some commercials, but again, I was kind of half paying attention to them. So I'm just wondering if what you're talking about is similar to the PSAs that they're running on TV right now.
It sounds to be the same. One of the things that I think that I'd like to make sure we get out is the renew my coverage site. So there you can update your new address. There's also a tool that allows you to look up when your eligibility date and renewal will be happening. And so those are some of the resources. And then for many of you who are, I think, going to be delivering some of this message, one of the things that I will want you to have on hand as well are the communications toolkit. Again, this is what we have. It may not be sufficient. It may not be hitting the mark. There could still be confusion. And so there's that opportunity, but at least I want to make sure that you have that in your hands so that you can make use of that.
Excuse me. And then one other question. This is kind of getting in the weeds.
Mhm.
Will the site have the plans available based on the county you live in? And I'll give you an example. When I was living in Ramsey County, I had Blue Cross. And then about a year or two ago, 2 years ago, they dropped Blue Cross. So I ended up going over to United Healthcare. And I'm just wondering now, since I'm in Hennepin County, would that Blue Cross, would it say if Blue Cross is available in Hennepin County?
On the site,
Yes.
I don't think so, but there is contact again for either, you can contact your county or the Navigator organization, and I think they could help with that information.
Okay.
Yeah.
Good. Thank you.
So my question is kind of piggybacking on one of the your area of wanting to have a conversation about how we can partner or how we can get the information out. And my concern is the statistics show in our community that during COVID, over 42% of nonprofits and longstanding partnered agencies closed in the Black and Native community. So with that being said, some of these agencies have been long-standing for many of our community members who trust them and know them and have those kinds of relationships. With those agencies closed, and we as leaders and family, et cetera, looking to have those partnerships so that we can help to fill the gap. What are we going to be doing to support or replace those longstanding agencies?
That's a good question. I don't know that I have that answer for you. I think, yes, that's a loss, and how do we reclaim that? So that's a bigger conversation. Why have we not invested? Why and how are we going to reinvest? As it relates to the outreach for this, I think we have to go based on where we know those connectors are in the community. In this case, for example, council like yours, but faith-based leaders, schools, libraries, as I said, Navigator organizations, grocery stores. We just have to do as much as we can to be in the space where the community is, to the point of the loss and how we need to prioritize the investment, that's a bigger conversation that I hope councils like yours will take up and bring forth to the state and to the legislature. I mean, I feel like this is not something that I necessarily need to tell you, but I hear you, and I think it warrants us to figure out why that has happened and how we're going to recorrect that, because those losses mean loss of trusted organizations to support in this effort. And I would just add one of the things that I think it's important in my role, but many of us in the roles that you all hold, is to say we should not have to refigure out how to do this each and every time we have a need. We need to invest appropriately and continue and sustain those investments. And so wherever I am carrying that message.
Just one more question related to community engagement. How does HIPAA play a part in that? Like, this is HIPAA kind of information. And if I'm, for instance, in a church, do I need to be trained in how to handle that information, or what other protocols to protect the information of families?
Mhm. That's a great question. And I think an important consideration depending on what level of information we're seeking. So there's the first part of sort of getting the right information and delivered in the right, in the way that people need to hear it, and then the process of one acting right, um, being able to respond. I think that's really where we have to be able to know we may not be able to do that or have the right resources like the navigators there to help to assist. Yeah. So there's some questions here, but it seems like this group didn't need any guidance to get us to this. Um, and so I'm hearing a lot of to part 3 and uh, you know, that there's a lot of confusion. I think that's what I'm hearing. Again, I want to reiterate this is the first conversation, but I'm hopeful that you would be willing to invite me and others from DHS to build on this conversation. And then also to let us know what you are hearing in the spaces that you're in, where we're continuing sort of to see that continuous confusion that I think is going to lead to people maybe not having the right information or just not acting because it is too confusing.
No, thank you, Helen. I think the other thing that you brought up that I think where the council can absolutely dig in is when you talked about hosting roundtables and having these discussions. So being able to have a few of us present at those roundtables, obviously we'd have to be cognizant that if we did and the whole council showed up, we would just have to make sure that we are announcing that we're going to all be in the room together, because then now it turns into an open meeting. And so we would just want to make sure that if there are opportunities from that standpoint, I think that would be advantageous, because at that point, then everybody could bring to the table which community that they're representing, or if it's a specific area. So I think about, Carl, who is Duluth. So how do we bring what may happen in Duluth to the table for the roundtable discussions? Or if we have people that are represented from Rochester or some of the outer, the greater Minnesota areas, then how do we make sure that voices are heard and that information is shared? So, I mean, that's one area where I could absolutely say that, the council would be willing to share in those roundtable discussions.
Wonderful. And I'll follow up with that information. And as you're able, I think we do need to have your voices there. So I guess if there aren't any more questions, some of the things I want to just make sure I get to you, Linda, is the communication toolkit, the lookup tool, the resource to be able to update the address for folks, and again, this one pager that gives you the information to connect with community relations, my office, and then as well as the information around the roundtables as you deem that feasible for you all to attend. And I'm hopeful that you would be willing to invite us again.
Absolutely. No, thank you for that.
Thank you so
And we
much.
do put out a newsletter weekly. So I mean, some of the things that you had mentioned, we'd be happy to put that in the newsletter just because there's a lot of people that either have questions and or just don't know where to go. And so some of the things, some of the information that you even listed here, I think that those things could go into the newsletter with contact information or with kind of a direct, because it's electronic, then we could have kind of a direct link. So that's another way to do that as well. But no, thank you, Helen, for spending your evening, because I'm sure it's been a long day. Jeremy, you as well online. Thank you for spending your time with us. We appreciate it. Thank you.
We're grateful. Thank you.
Thank you. And if I could just add to, sorry, feel free to send any policy or eligibility questions to me directly at jeremy.wilson@state.mn.us, and I can add it to the chat as well. But thank you so much.
Absolutely. Thank you. You're welcome to stay on, or I know if you want to enjoy your evening, you can. So we are going to move on. Any public comments? Joe, I know I had asked you before. You have a public comment? Okay. So we're going to move on to unfinished business, and Ash, my apologies, because when you sent me the agenda, I meant to make this correction. We have already had this discussion as far as engaging the governor's office and community. It really was supposed to be an update. I went back to the notes, and we had volunteers that had said that they would be a part of this communication. And so I just wanted to know, did we have an update on have you all met, or there hasn't been quite a meeting yet? So I don't know, staff, do you all know?
In terms of meeting with the governor's office?
No. So I was telling Ash that I meant to change. It shouldn't have been engaging with the governor's office. This should have actually stated the update on the communication work group.
I believe that Flockamy has scheduled the meeting,
Okay.
and that should be coming up shortly.
Okay. So that was the correction that I meant to make. When I saw the agenda, I was like, oops, that's not what it should have said. So that was really what that piece was. The other thing with the meeting structure, we still continue to bring this up, and I think it's still a challenge, right? So we try to do face-to-face today, and we still have people missing. So that may be something that you all want to discuss at the next fiscal year. How do you want to operate this? Do you want to continue to do this hybrid model? Or do you want to say only so many meetings will be face-to-face? One of the things that I will bring to your attention that was brought up last time was for February, that's typically our African Heritage Day on the Hill. We may want to rethink not actually doing a meeting that same month, because we end up showing up, and if you're on the executive team, you show up 3 times for that month. And so that's just something that I want to put out there, because I won't be here, but somebody else will. But just kind of keeping that in mind, that when February hits, you all may just want to consider that as an in-person meeting, and then not necessarily do an additional meeting, and just encourage people to come out there. Typically, if we do that, one of the things that was mentioned is you usually have to have like a quasi meeting, so we could figure out how that could be done. But I think it would be advantageous, because what we did notice is attendance was lower because we had just been together for the Day on the Hill. So that's pretty much that piece. Any questions for those 2 pieces that I mentioned? All right, so we are going to move to new business. Only new business that we have is, if you all recall in the bylaws, so that we're not rotating new people, or rotating older folks off of not older folks, that's not the word I want to say. Look, I'm talking with myself, y'all. We don't want to rotate folks that have already been in position, so that we end up with a brand new executive council. And so we had opted a while back, if you all remember, to say every other year we would do vice chair and secretary, and then chair and treasurer at the beginning of a biennium. And so because July 1st will be the beginning of a new biennium, we are now at the point of election. And so what I told Linda is typically, if I was running, I would not run the elections, but therefore I'm not running. So I will run the elections this time for the chair and for the treasurer. And I want to do it separately. I know that there were two names that were brought forward. So again, just kind of reiterating, in our bylaws, we do say, unfortunately, that you cannot have a proxy. So whoever's in the room is the folks that are going to account for who's going to be the next chair and who's going to be the treasurer. And we do have a name that was not put on the treasurer ballot, correct, Linda?
That is correct.
Okay.
And that's our incumbent.
So Tawana Mullins does want to run again, but by the time she got back to Linda, Linda had already pre-printed the ballot. So you could write her name in, or if you also have, another person that you would want. But right now, openly, we have two names, and I am going to open it up so the slate is clean. But I am going to open it up for nominations. The two nominations so far that have been brought, and they were self-nominated, was Yolanda Adams Lee and Wayne Doe for chair. So are there any other nominations for chair? So with that, Linda, if you want to hand out the ballots. And what we've done, and I will open this up for you all, again, what we've done in the past, that we've always asked those that are running to kind of just share with us why that they want to run, and anything else that you want to share. So I will start to my left. Yolanda, if you just want to share why, and then we'll have Wayne share why as well. Yeah, because Ashley.
Can you hear me? So my reasoning for wanting to throw the hat in for chair is based on just my own love for the council and how long I've been a supporter and a participant. And my concern as a person of color in our state and in our community, and the needs and the voice that I think is necessary in order to move things forward. So I don't typically toot my own horn, but I've been doing this a long time in various venues as far as community work. And I have a love for it, and I believe I have a gift for it. And I think representing the agency would be an honor. So that's why I'm putting my hat in the copper.
Okay, well, as far as I'm concerned, I've over the years observed the work of the council, almost about 30 years or so now, even before I started to visit the council and see the work they were doing, and got really interested in the work because it represented something very special in terms of addressing the issues of equity and all of that within the state of Minnesota. And just in the past 4 years, I can tell you, there has been such a transformation after coming on, and of course, in terms of getting new leadership. And I've seen that trajectory going in a new direction, which is going towards accomplishing the goal that we set out to do. And my interest is to make sure that we continue on that trajectory, because I think bringing the kind of leadership, the kind of diversity that we have within the state of Minnesota is so crucial. We cannot look at our past, I would say it's got to kind of define us, but we look at our past as opportunities to what we need to do today to move us forward. And today's reality is what's important. So the challenges that we face, how do we address that? So I think by coming together the way we are as a council, with the kind of diversity that we have, the kind of value we bring, I think we can move, we are moving in a direction. And I want to, I know I will speak to that later on, but our chair had played a very important role in this whole process and the executive team to move us. So I'm just looking forward to continue that route where we are, engaging our communities, bringing us together to talk about our issues and moving us forward as one in addressing all of the issues we have. So I'm putting my hat in this race because I want that continuity in terms of the transformation that's been going on. Thank you.
All right, thank you. All ballots have been turned in? Okay. Oh, no, you're fine. That's important. And we will announce at the end of the meeting. Now nominations are open for treasurer.
I nominate that the current treasurer continue that position.
Okay. Any other nominations? So Tawana Mullen's name has been put forward. All right. Nominations are closed, so ballots are coming around. I think you just have to write her name in.
My grandmother who said, "Boy, you know what I mean."
Exactly.
Don't roll your eyes at me.
Yeah, boy, you know what I mean. What kind of California were you? I was born and raised in LA.
Yeah.
I went to Vermont High School. Yeah,
Oh, all right.
back in the day.
Compton High.
Yes.
Yeah.
All right, thank you. So last piece of business, I noticed that we didn't have any reports. Is there any quick update that you all can give us? At least Theo, come on, we just ended the legislation session.
Right.
I'm gonna throw that in there and then we can go to announcements.
All right, good evening, good evening. All right, so we concluded the 2023 legislative session adjourned May 22nd. And I mean, it was a historic session in Minnesota. I think that I'm sure you guys have seen the national, I mean, the national coverage of what's going on in Minnesota in terms of what happened with the legislature this year. Really landmark stuff happened. In terms of highlights related to some of our own priorities and some of the things that we've been researching and advocating for on the economic front, the session ended with two bonding bills, two major bonding bills, funding for capital investment infrastructure projects. And the key thing about that, and particularly I think House File 670 contained a lot of what we might call equity focused or equity lens legislation in terms of funding coming into our communities through that piece of legislation. So that was an important bill to pass. The jobs and labor budget contained about 50 million, just a highlight, 50 million for workforce development for people of color, 125 million under the Promise Act for funding for businesses and community organizations impacted by structural racism. So that's a really important measure there. The education budget and contain increased funding. We were really pushing for increased funding for early learning scholarships, full service community schools, community-based after-school programs, and the Increased Teacher of Color Act, some funding related to that as well. And it also contains the Ethnic Studies Bill and the ban on dismissal of K through third grade students. So funding around non-exclusionary discipline or training to build more inclusion, sort of more inclusive culture, trauma-based student services in our schools, student support services in our schools. And the health bill contains key investments around anti-racism and health equity, including the creation of a new Office of African American Health within MDH. Also important there in terms of stuff we're pushing with some partners is funding to expand access to healthcare. So Minnesota Care, the public option, establishment of a public option for Minnesota Care, a pathway towards that, and also to allow undocumented Minnesota residents to be eligible for Minnesota Care. That was a big deal during the session. And finally, on the public safety side, there was 70 million in there for community-based violence prevention, and also the Civilian Oversight Council's bill, which would allow local governments to establish those types of councils and also grant them authority to investigate misconduct by peace officers and also recommend discipline. So those are some highlights from the session. And we will have more reporting and analysis on what transpired in the weeks and months ahead. Yeah.
Thank you.
Sure.
Go ahead.
One thing, Chair, to mention also is restoring the right for people to vote who were formerly convicted.
Absolutely.
Impacting our community.
Big time. Big time. And that was a big
Yes.
So any questions for Theo? Go ahead.
Madam Chair, I just want to add to what I witnessed at the Capitol this year. I was heavily involved, and the money is mammoth, is huge, never in the history of Minnesota. So now that the legislature is done, the job goes to the community, to the people. In the next 2 to 3 years, how do we get our people ready to tap into what is coming? So that's the biggest challenge. It's not even the money anymore, but how to utilize the money in the right way. So I just wanted to bring that up, and that's something that the council can play a very vital role going forward. Thank you.
Any other comments, questions? Any announcements? Go ahead.
Want to announce our Juneteenth Jubilee. It's happening on, that's right, woo, woo. It's happening on Thursday, this Thursday, the 15th, from 12 to 4. It's on the Capitol grounds, and we are doing it in partnership with the offices of our friend, our beloved Senator Champion, and then Representative Ruth Richardson, who are both the authors of the Juneteenth bill. So it's going to be a great time. We're going to start off with a press conference at noon, follow that up with some fun, and family and agencies are going to be out there. I don't know if you guys are going to be out there. Okay, because if you're not, then we're going to have a conversation at this meeting. But so we'll have agencies, there will be vendors, there'll be a little food out there, and there'll be some fun for kids, bouncy house and all that kind of stuff. Because this is a momentous occasion. So we are celebrating the fact that the bill was signed. So come on out Thursday, 12 to 4, June 15.
Awesome, awesome. You have an announcement? Go ahead.
Center of Economic Inclusion, they have their annual, I think, gala coming up later this month. So, ED, I'm not sure if you guys are aware of that, if we are going. Okay. So, even if we're not going as a council, it's important that whoever that can show up, should show up. The center is doing great job in our community, and we need to support them.
And I'm glad you mentioned that. I'm going to check into that. But also the NAACP gala is Saturday, and a few of you have signed up. So thank you. We're going to have a great time. But if you did not sign up, we do still have some opportunities for you to go. So if you're interested, let me know after this meeting. We're also tabling at that event.
I was going to ask, are you all
Yeah,
tabling?
we're
Okay.
tabling too.
So with that, it's been real. It's been fun. It's been 7 years that I have served on this council. Yeah, 7 years. 2016 was when I was first appointed to this council. It's bittersweet. I've lived in Minnesota all my life, with the exception of the short stint that I went away for college and came back. But no, just, I know that you all are going to do great things. It's been a pleasure getting to know some of you. Some of you we've known all of our life. Looking at Andre. And some we have long-standing relationships, looking at Linda. But but seriously, I mean, I know that the council will do great work. We've come a long way. So if we think back to even 2016, even during the pandemic, I mean, some of the things that the council was doing, and we know that there were naysayers out there. Let's just keep it real. I know this is recording, and I don't care. But there were naysayers around, the council, all of the ethnic councils, to be honest. And so the fact that we've been able to move the needle forward, one of the things that I made sure to do while I was the chair was to invite different state agencies, and specifically invite different leaders. So pretty much every commissioner has come, and if it wasn't the commissioner, it was the assistant or it was the deputy commissioner, has come to this council and they've presented. So we did have an opportunity to have all 26 agencies to come in and present, and it was a way for us to engage with them, to hear what they were doing, but then also how they can engage with us. And there was a lot of them that didn't know how to engage with us. And so as a result of that, I just know that we're going to keep moving the needle forward. We're seeing the movement. When you mentioned all the different bills that pass, I mean, those are huge milestones. So we should be proud of the work that we've done. Keep moving forward, keep getting engaged, because it's only going to get, harder. I mean, I'd love to say it's going to get easier, but it's not. So I just want to say that before we dismiss. The other piece that I will announce is our new chair will be Wayne Doe, and our treasurer will be Tawana Mullins. And so we'll have to let Tawana Mullins know that you put your name out there. You ask and you shall receive. So that is that. But then keep in mind, next year you all will vote on vice chair and treasurer, because we do it every other. So there's an opportunity, actually, and with Wayne becoming chair, you all may want to do that sooner. And so I would recommend that in July, you actually do vote for a new vice chair, because Wayne will, now that's going to be open. So there are opportunities. So Yolanda, there are opportunities. She ain't looking on this way. Vice chair. I said, since we need a vice chair, there are opportunities. Well, that's because Wayne's now going to move to chair. So now we need a vice chair. But with that, do we have anything else before I move to adjourn?
African American. I talked about this a little bit our last executive council, but I'd like to bring it forth again so that we can continue to have support. The African American wellness, where with the children, we have last night I've been meeting. I've been meeting almost every week with this particular council. It's been very aggressively moving forward. The chapter has been put together. We have agreed on the chapter, and I think we're moving forward with that. The other component is that we do have a lot of great thinkers that are part of this chapter. And so I think one of the things that the council can help to do is to encourage this new agency to keep its eye on the prize, which is about children, not about positions, not about egos, not that, it is what it is. We have 4, commissioners, we have executive directors, we have lots of people with big ideas and have done great things in Minnesota. However, what we need at this time is to have a consistent constituency that is looking forward to making sure that children of color, African American, African children need to be placed in African homes. And we need to have something similar to ICWA in our community, African American Preservation Act. We need that in our community. We still have 67% Black children are in out-of-home placement in this state, and they are being adopted by people who don't look like them. And so children are committing suicide left and right in adoption, in foster care, and in adopted homes who are under the age of 12, ladies and gentlemen. It's real talk. So that is, I'd be glad I don't have to have one meeting starting in July, but it's honorable work. But it's not for the faint of heart. I do hope that we don't lose our traction, and that once the charter comes forward, I hope people don't drop off. That often happens, and so we've been having all kinds of conversations, and how to continue to partner. So that's my comment.
Tawana just texted me. She was trying to get off mute because she's on. So I don't know. Can we unmute her?
We can. Ash, you can try to. I don't know if Jade might be able to. Now that, yeah, we were not able to do anything while you were presenting, but there's someone who is on mute that wants to speak. Tawana.
Tawana, can you speak now, or are you still on mute? They're trying to work it out now. She says she's still on mute.
And while we're waiting for Tawana, while they're getting that together, I just want to